Hi, I'm Wade Boyd, and this is my persuasive speech. My audience, please introduce themselves.
Brian?
Amy, Carolyn,
Tommy?
Jim.
Cassie.
Now that my audience has been introduced, this is my persuasive essay over American healthcare. Healthcare is one of the most important issues in American politics today. One side believes that healthcare should be a right, with the government providing its citizens with access to quality healthcare. The other side believes that healthcare should be a commodity, which is a good provided by a private company for profit. In America today, healthcare is a commodity, with a multi-billion-dollar industry behind it, with insurance companies making more billions. In this speech, I will try to persuade you that the United States should adopt a single-payer or universal healthcare system. Let's start by taking a brief look at the history of healthcare in the United States before 1965. In the old days, before the 1930s, the only way healthcare was provided was either you had the money to afford a private doctor, you relied on the charity of others, or you didn't receive it. And this started to change in the 1930s with the New Deal. During the Great Depression, President Franklin D. Roosevelt introduced Social Security, which had some provisions for mothers, children, and the disabled. And this was the first iteration of any government involvement in healthcare in American history. And it was like that until the 1960s, when in 1965, Lyndon B. Johnson, as a part of his war on poverty, signed Medicaid and Medicare into law. Medicaid, which provided healthcare access to poor people, and Medicare, which provided access to the elderly. And these programs expanded coverage to over 19 million people in 1965 who previously didn't have healthcare. In 2025, that number has grown to nearly 80 million people, according to Karen Valitas. Also during this period, senior insurance went from about 50% in 1965, and this number jumped to 96% soon after, according to the Center for American Progress. In 2010, healthcare in America changed again. The Affordable Care Act expanded Medicaid to 138% of the federal poverty rate was now eligible, which included nearly 38 million people. The rate of uninsurance also dropped from 14.4% to 7.9%, which was a record low. The Affordable Care Act also banned insurance companies from discriminating against people with pre-existing health conditions, such as diabetes, heart disease, cancer, and this allowed for easier and cheaper coverage for those people. According to the Center of Budget and Policy Priorities, the ACA has prevented more than 150,000 unnecessary hospital readmissions since its inception in 2010. All right, now that we've covered the history of healthcare in the United States, let's look at some problems that are still present. In the United States, more than 56% of all employed people are underinsured, according to the Commonwealth Fund. A universal system would allow for more people to receive the care that they need. Another problem is treatment in the United States is more expensive than in other countries with the same economic development. Some diseases, such as cancer, can be extremely expensive and wipe out a person's finances. The average cost that a cancer patient will incur over their treatment is about $150,000, according to Sarah. This can be ruinous for many people, as people with cancer are oftentimes too sick to earn an income while they have cancer. Expanding healthcare access would allow for everyone, including people with lower incomes or people with terminal illnesses that prevent them from working, to receive treatment without needing to go bankrupt or not receiving their treatment in the first place. If America adopted a universal healthcare system, it would become a healthier nation as well in a variety of ways. According to a study by the Organization for Economic Cooperation and Development, the rate of diabetes, which is a lifelong and incurable illness, in the European Union is approximately 6.2% of all adults. However, in America, this number jumps up to about 11.6% of all adults, according to an article from the National Institute of Health. The differences between these two regions is that the European Union's many nations all have subsidized or universal health care, making it easier for patients who are pre-diabetic, which is a reversible condition, to receive care they need before they become completely diabetic, which again is non-reversible. In a nation with universal health care, anyone with an illness would be able to walk into a hospital or doctor's office and receive the care that they need. However, in modern America, if a person does not have health insurance, they are often restricted from visiting a doctor, and which can lead to the person developing chronic illness such as hypertension, heart conditions, so on and so forth. It seems that one way to make America a healthier nation is to implement healthcare reform so sick people can receive the care that they need. Moving on, the human cost. According to a study by the National Library of Medicine, universal healthcare would save an estimated 68,500 lives per year. And the reason why these lives aren't saved currently is because a lot of these people do not have the either income to afford private health insurance or are unemployed or underemployed. Another study from Yale suggests that more than 335,000 lives could have been saved during the COVID pandemic if the United States had a universal healthcare system beforehand, along with $105 billion in healthcare in unnecessary hospital expenditures, according to a Yale study. Cost. Some critics of proposals for healthcare reform often assert that universal healthcare would be too expensive of an endeavor. They claim that citizens would end up spending more money in taxes than they would otherwise save from reduced healthcare costs. However, this is simply not true. Higher taxes would be needed in order to actually implement a system of this magnitude, but the academic consensus is that patient savings outnumber the amount of new taxes that would be needed. According to an article by the University of California at San Francisco, quote, the researchers are able to estimate longer-term savings by using cost projections in 10 models. By the 10th year, all modeled single-payer systems would have saved money, even those that had projected higher costs would initially increase, end quote. This shows that even the most expensive models that we do have would still save Americans billions of dollars on healthcare every single year. According to another Yale study, Americans would save over $450 billion per annum. Blair, 2022. In conclusion, it's become obvious that healthcare reform is a must for the United States. If the United States introduced healthcare reform, citizens would save hundreds of billions of dollars and tens of thousands of lives every single year. It would also give a sense of security to those who have a chronic illness that keeps them from earning money, such as cancer, from going bankrupt from medical expenditures. Lastly, universal health care is a possibility in the United States, as multiple bills have gained significant traction in Congress and amongst the general public. This shows that universal health care is both a good idea and a popular idea at that. Thank you. Now introduce.
Brian.
Amy, Carolyn,
Lonnie. Jim.
Cassie.